This segment is sponsored by Virginia Family Dentistry.
I'm Jessica Null with Dr. Pete Appleby here at Virginia Family Dentistry. Doctor, we're talking today about implants, and this is a conversation that you have with many patients because tooth loss affects so many folks in this country.
It really does. We estimate around 170 million Americans are missing one or more teeth, so it really is a common problem.
It's one of those things that happens, and I think you may say, well, I'll take care of that. I'll let that fit. I'll get to that. I'll fix it later. And oftentimes you may let it go, and there's a real problem with doing that.
Yeah, absolutely, and especially with like a back tooth, sometimes we don't notice that as much, or you lost it as a young person and it's been many years. But we do think it's important to get the area addressed because tooth loss can lead to more problems with the other teeth, especially bone loss in the area where the tooth has been lost. So it's important to get a plan together, speak with a dentist, figure out what's happening and maybe how to fix it because potentially more than one tooth can be affected by that single tooth you have lost.
Many folks watching right now might think, well, it's cosmetic, right? I don't need to, of course there are reasons to do that. Or they may be embarrassed. They may think, oh, I don't want to tackle that. But it really is more than cosmetic, and it should be handled.
It really is. I mean, teeth are all about quality of life. I mean, speaking, smiling, chewing. And we have 28 of them, and I think sometimes we think that means we can lose one or two. But no, they're really designed to work together in unison. So it is important to consider replacing a missing tooth to prevent that wear because we have many decades on our teeth. And unlike other tissues in the body, they don't heal. So that wear will manifest and add up, and all of a sudden you might be dealing with a lot more dentistry than, again, just that single tooth that can usually be addressed in one appointment.
A lot of folks watching may say, well, I've heard of implant, but really if you had to define it, they might not be able to. What is an implant?
It's a great question. I mean, it is a little confusing exactly what we're doing there, but I like to think of it as an implant as a synthetic root, okay? So it is actually placed under the gum in the bone, and it's going to support the porcelain crown that you'll see when you're speaking and use when you're chewing.
And so then once it's back in, you almost have, you have full functionality and you're back to maybe a new sense of normalcy.
Absolutely, because also once the implant's in and has the porcelain crown on top of it, you're going to brush it like a normal tooth, floss it like a normal tooth. It doesn't involve the adjacent teeth at all. So it really keeps, if you are just missing one tooth, it keeps it kind of a one-tooth problem. So another great point about implants is that it actually preserves the bone. One thing we don't realize about tooth loss is that when we lose the tooth, we lose the bone that supports the tooth, and the tissue that attaches to that, including your cheek, whatnot, starts to migrate down with that bone loss. Implants will stabilize the bone in the area, preserving that bone, and especially preserving the bone on the adjacent natural teeth you do have. So it really solves a lot of problems that we've had in dentistry, and that's another reason we're so excited about it.
Doctor, let's say this happened years and years ago. You've been missing a tooth for a long time. Mm-hmm. Can you still do an implant?
Absolutely, absolutely. You can still do an implant. And actually that brings up a good point that some of the new technology that's in implant dentistry with 3D imaging allows us to really understand how much bone you may have lost. And you're right, 90% of the bone loss happens in the first year, but that bone loss will continue over time if the tooth isn't replaced. So often if a patient's been missing a tooth maybe 3, 4 longer years, we'll get a 3D scan, and that can help us decide, do we need to do some grafting, bone grafting, which some patients may have heard of, to get the area ready for that ideal implant placement.
So in terms of that 3D modeling too, you have a team very familiar with working with implants, creating, fabricating, and really making it happen here.
Absolutely, it's pretty exciting. Virginia Family Dentistry has really been excited about 3D imaging. I think we really embrace the technology. We use the technology from treatment planning into the placement of the actual dental implant. We can use surgical guides that help with precision. And then actually when we fabricate the custom porcelain crowns, we actually will do some 3D modeling, 3D printing. We use CAD/CAM with our in-house laboratory. So that's really made a seamless integration there between the clinical part and the restorative part that really builds the beautiful porcelain to make that seamless and reduce the amount of appointments for our patients. So what was already a great technology is just really only getting better.
So definitely an option for many people. The next question is always, how do I pay for this? How do I make it happen? They're not the least expensive option out there.
Definitely not, but the investment in yourself, in your self-confidence, in your ability to choose chew and speak again is worth the investment. And that's why I always recommend patients to come in for a consultation. At that point, we can take a look in the mouth, we can figure out exactly what you need, and then walk you through those steps. And the good news is there's lots of ways to finance it. There's insurance options, and what you may have heard a few years ago, if you've been looking into this, may have changed now. So it's worthwhile to come talk to a dentist and get an idea of what you need, and usually we can tailor a plan that works for everybody.
Get that conversation started. Virginia Family Dentistry has 15 locations throughout Richmond. You can call 804-362-2400 or visit online, vadentist.com.